All right. Good afternoon. Thank you for being here today. My name is Jessica Hayes, and I'm the Work-Based Learning Coordinator with Alignment Rockford. We are here again with our weekly live Zoom to YouTube panels. With me today, I have Addie Billington. She is a first-year medical student at UIC Rockford. And then I have Teri Keller. She is a nurse manager with an RN BSN at VanMatre Encompass Health Rehabilitation Facility. And then I also have Jordan, who is our academy coach with the special education students, joining me here today to help us moderate. Thank you all for joining me. I greatly appreciate it. And Teri, let's get started with you, and you can kind of tell us a little bit about your background and where you're at and what you're currently doing.
Okay. My background. So I'm a nurse, and this is not my first career. So there's always hope if you decide you want to change to do whatever you're doing. At one point, I had a different career. I stayed home with my kids for a good 6 years. I decided I wanted to be a nurse. Like, that was always my passion. However, I didn't really know how to get there. Therefore, I kind of didn't do it. It was early 1990s. Once I started, though, I worked as a CNA and went through nursing school. And I've done different types of nursing. I did orthopedic neurology nursing for a couple of years. I then went into cardiac. And also specialized in stroke. I absolutely loved that. I did some charge nurse, and that's when I kind of realized, oh, I kind of like that leadership aspect of it. Was a house supervisor for many years, and now I'm at VanMatre. Started as a supervisor, and now I am the manager. So I love nursing.
That's really awesome. Can you tell us just a little bit more about that road, the CNA, and working towards getting an RN, and how you did that with going to school at the same time?
Yep. The CNA, really, it's a class. I believe there were, a few maybe English and math prerequisites. Other than that, it's simply a class, and you take a test and you're a CNA. So I got into the hospital that I wanted to work at, and I did it. I was the mom. I was married, went to school, and even after I graduated from nursing school, went right into the RN role.
Okay. Where'd you graduate nursing school from?
Rock Valley.
Rock Valley. Awesome. Awesome. Addie, can you tell us a little bit about yourself and how you ended up here at medical school?
Yes. So I have always wanted to be a doctor since the longest I can remember. I was about 3 years old when I started saying I wanted to be a doctor. But however, no one in my family is in the medical field at all. So I didn't really know kind of like how to go about getting there. But it was just always my dream. That's always what I wanted to do. And so I graduated from high school in Southern Illinois, about 5 hours from here. Then I went to undergrad at the University of Mississippi. And because of my dual credits, I was able to graduate a year early from that. And then I had a year off, which was nice to do all the applying to medical school interviews and all that. In my year off, and then I ended up here. So I'm now towards the end of my first year of medical school. We have one block left, and then I'll be an M2.
So can you tell us what's your ultimate career goal? What kind of doctor do you want to be?
Yeah, so I am really interested in OB. I've always been interested in OB. I actually helped deliver my baby brother because I've always wanted to be a doctor. So my family knew that and talked to the doctor. So I was 11, and they let me come in the delivery room and be the first one to catch him and do all of it. So ever since then, I'm still super interested in OB, and that's what I want to do. So I don't know, like, we have year 3 and 4 is when you really start seeing stuff and really kind of like get to decide what you want to do. But that's at the top of my list for now.
That's awesome. That's awesome. I'm going to ask this question later because it'll be, think about like things you took in high school, or like classes you took that made it easier, I guess, or things that you focused on in high school in order to help you down this pathway.
Yeah, so I did take dual credit. My high school offered that. That helped as far as getting some of like the general stuff out of the way. I didn't have to take those at a university, or like calculus. It wasn't my favorite class, so I could get it done in high school, and I didn't have to deal with doing it at a university where you have bigger classes. So that was good. That helped. But other than that, I didn't have like a pre-med track, like you were explaining the pathways to me. I think that's awesome. I didn't have that. So I really started most of my pre-med preparation
It's awesome. Thank you for that. Sorry, we had a couple of issues going on the side over there, but thank you for that information. And Teri, can you tell us a little bit about how you, I know you said you changed career paths, but can you tell us a little bit about what excites you during your day? What excites you during this work?
Yeah, I would say when I first started, I always kind of felt like when I was at work that I wasn't really working, that I just really enjoyed it. I liked it. At this point, what excites me is I love being able to help make a difference in our patients' lives. But with the role that I have now, I'm even more so my staff. I have to take care of my staff so that they can take care of patients. And, you know, especially with the pandemic now, there's a lot of challenges, and keeping morale up is something, you know, that we're all fighting and trying to keep. Why do we come to work every day? We're in healthcare for a reason.
And that kind of leads me into my next question too, is what, and Addie, this will go to you and kind of your education. And Teri, how do you spend your day? Do you spend most of it working as collaborating as a team, or is it more individually during your work day?
There's certainly times when I'm on the I have more than enough work to keep me busy where I could be on the computer all day long. However, everything, especially in rehab nursing, it's multidisciplinary. We collaborate with everybody. I work very closely with the CNO, with my supervisors, with the charge nurse, with the nurses on the floor, and even in direct patient care, helping patients. If I walk by and the call light's on, I'm going to help them. And with every level in our organization, we all have to work together and understand what our patients, what they're going through, and kind of what is the plan of care so we can make it happen.
That's awesome. And a lot of the questions just come, you know, how do you spend your day? Is it, and students want to know, they want to know what the job is really like.
Yeah.
So Addie, throughout education and you going to school and now in medical school, tell us a little bit about what it's like. What is the, to prepare a student for what the atmosphere is like in their undergrad and preparing to go to medical school?
Yeah, so I really love our curriculum here at UIC is it's pass fail. So I know most people going to med school are kind of overachievers. You always want that A or that B. And so it really takes the pressure off from that standpoint. I almost feel like there's less stress in medical school than there is in undergrad, because in undergrad, you're always trying to get there. And now you're here, you made it, and you know that you're going to be able to pass or the faculty will help you. So there's almost less stress here. I will say both times you spend a lot of your time studying. It just looks a little bit different. Now it's all stuff that I'm super interested in, which is why I always encourage people to choose majors in undergrad that they're interested in, even if it doesn't seem like it's a pre-med major. You'll enjoy it a lot more if it's something you love. Whereas now I'm doing all of the body systems learning. So we just finished cardiac and pulmonology. We're about to go to GI. So it's super interesting stuff. It's a lot of hours that you put in. As far as like individually versus with people, we've been all online for medical school. So anytime that you want to see people is kind of on your own, and I'm a people person. So I go to campus and study a lot. There's a lot of material to get through. So most of the time we kind of do our own individual studying, but we're all kind of near each other just to have that support of just being next to other people going through it. And then we also have TBL classes, which are team-based. TBL means team-based learning. So they give us a team and you're with them throughout the whole first 2 years. So that's very collaborative, and you get a quiz that you do together. And so in that sense, you do get a lot of teamwork from that, but you do spend a lot of time individually studying as well.
What was your undergrad in?
I had a major in biology and a minor in chem and psych. So okay. I just chose the one that most aligned with all my pre-med prerequisites, which was good. I didn't have to take a bunch of extra classes, but my upper level classes were more just like strictly bio, whereas I'm not super interested in like plants and stuff that I had to still learn about to get that major. But I have a friend who really loved writing, and she was an English major, and she's also in her first year of medical school now. So you can do it with whatever major you want as long as you get those prereqs.
That's great news. That's really good information to share. And I'm sure if there's students that have any questions after this, both of you would be open to emails with some questions if we don't get any in the chat at this time.
Yeah, for sure.
Awesome. So I guess, Addie, you kind of talked about, helping deliver your brother. That's a really cool project to say that has really made you more passionate about what you're getting into. But is there any other projects or anything that you've worked on that have really developed you and made you really, really focus on this going into this career? Outside of delivering your brother, of course.
Yeah. Yeah.
I mean, that's a pretty good one.
So in undergrad, I had the opportunity to do some research, and I did that in psychology. But since I was interested in the medical field, I wanted to do something that had to do with medicine. So I looked at depression and anxiety in pregnant women and was able to be screening those pregnant women and just to see how prevalent that was. So it was really cool to be there and be with the patients. And then it also gave me a really good talking point for interviews because I was passionate about it and was able to tie in research with what I loved. And research is something that's kind of continuing. So I did that in undergrad. And then once you're in medical school, they also want you to try and get some research for when you apply to residency. It's kind of a never ending cycle of you're always applying for something. So you're always trying to fill up your resume. So I recently got on to some more OB research with residents, and I'm going to be working on that over the summer, just looking at a lot of different things with different outcomes in pregnancy. So I won't bore everyone with the details, but it's just more OB research projects and a few other research projects handed down to me from some older students. So yeah, there's always lots of projects to do in this field.
That sounds exciting. And it sounds like you can pick a project that fits within what you're passionate about. It doesn't necessarily have to be a project that's, it sounds like you can actually pick stuff and research things that you're passionate about that you really want to know versus having to just research what's been given to you.
Yeah, you can actually make your own research project completely from the start. I met with someone about doing that this summer. You just there's a ton of people within the school, and no matter what medical school or undergrad you go to, there will be those people, but you just have to find out, has it been researched before? And if there's not a bunch of data on it, you can go ahead and start one on your own. So there's really a ton out there for that.
So it sounds almost like kind of like an entrepreneurial spirit as well as medical school. Like you get to do a little bit of both. Teri, can you tell us maybe a project that you worked on that's really exciting that you would want to share with our students?
Yeah, we have a lot of stuff going on. I recently, this past week, started doing education to all of our staff on, it's called LVAD, so left ventricular assist device. It's a fancy contraption for people with really end stage heart failure. And it's implanted in them, and then part of it's external. And this is going to allow us to take patients that have this device, which extends their life and their quality of life, especially in our rehab facility. So if somebody's been in an accident and they have this, that way our staff will know how to take care of these patients. In addition to that, I work with our stroke program. So I'm the champion for that. And we've just recently went through Joint Commission and we had no sightings. So that means we basically had nothing that they could find wrong. So that was exciting. And then currently in this next week or two, we're putting on a lot of new stuff. We're going to start testing for COVID here on site. So that's something new. It's not a very simple process. There's a lot of different steps to it. In addition to that, we're going to be starting a patient observer. This will mean that people are behind a big computer. They can watch maybe up to 12 patients. And basically we want to notify our staff, notify nursing staff if they're kind of doing things that could put them at risk of a fall. So we want to reduce our falls. Yeah, that's just a lot of different stuff. There's always something new coming away. And because we're such a big corporation, they're working in the background and trying to roll it out to all of us and new projects.
That's a lot of projects, but They all sound absolutely awesome and sound like they're going to be really great projects to get updated on here in the future because I think hearing from both of you really sounds like in the medical field, there's a lot of opportunity for being what you're passionate about and finding those research projects and being involved in things like this stroke team and this patient observer and really trying to develop programs that are really effective to patient and patient care.
Yes. And hopefully making it better for our staff too.
That's great. That's really great. How many staff do you have at VanMatre?
In the nursing department, we have just under 100.
Oh, wow.
So, There's a lot. Yeah, we can take up to 65 patients. Yeah.
Wow, that's a lot. That's a big employer.
Yeah.
What would you tell a student that maybe wants to go into nursing, or what advice would you give to a high school student that wants to go into this career field, Teri?
I think a couple big things. For one, the opportunities are absolutely endless. If you're not happy where you are, you just need to kind of do some research and figure out what direction you can go, because they're endless. You can do everything and anything. You can raise up to whatever level you choose to raise up, as long as you're willing to put the hard work into it. One thing that I've always really felt strongly about is I feel that, our young people, whether you be male or female at this point, because we have plenty of males in the nursing department, but I feel like this is your opportunity to be able to take care of yourself. If you can on your own own your own home someday at a young age, you can have your own car, you can travel, you can have all of that if you're willing to put the extra work in. And nursing definitely affords you to be able to do that.
That's great feedback. Thank you for that. And what kind of what classwork do you think that would be like? What kind of classes do you think would be a good for them to take to prepare them?
A little bit of math. People think that there's a lot of complicated math involved. There's not necessarily. There's some formulas that are they're pretty simple. You just need to wrap your head around and practice it. I always say practice it like it's a game. Definitely your bios and your chemistries. Those definitely anatomy type of things. The more you are exposed to that stuff, the more you can start putting together the pieces of how do our organs work and how do our systems work, and all of the different, everything just starts to fall together in your understanding of it.
Thank you. That's great advice, and good for our students to know maybe some additional coursework or what things they can look for in their coursework while they're taking classes in high school to prepare them for the next steps.
Yeah.
Addie, how about you? What advice would you give to somebody that's looking to go into medical school and go down your similar path?
Yeah, so first I'd say just find something you're passionate about, even if that's not necessarily in the healthcare field. So whether it's volunteering or something that you're involved with in school, something that you're passionate about that you want to be more involved with, and then completely immerse yourself with that, because that's going to help. If you're super involved with something in high school, you can talk about that through undergrad all the way through to your medical school interview. So continue, and if you continue to do that in undergrad, you're going to have more to talk about in medical school. So, and I think you in every different season of life, you're going to enjoy it so much more if you are involved. I've continued to get more involved with every step, and I enjoy it more and more each time. Yes, you're busier, but you meet more people, you make those more connections for networking, and you also just really enjoy it. So kind of those are my two best pieces together, do what you really enjoy and you're passionate about, and be really involved.
Find that passion and really embrace it and continue to work towards it, and use that passion to guide you in not only your career, but guide you in life decisions as well.
For sure. And as far as classes go, I would say the same thing. The sciences, anatomy, and then once you get to undergrad, I think it's really beneficial to take a good biochem course, and as well as physiology, because those really follow you. And so if you get a good understanding of that in undergrad or high school, if it's offered, then that's going to be really beneficial to you in the long run.
So I'm 15, 16, 17, 18 years old in high school. What are my next steps? Addie, if I'm going to look into, what do I do here? What do I do from here? What are my next steps?
Yeah, so one of the things I looked at are the pre-med I looked at the different undergraduate universities that I wanted to go to, and just looked at how their their pre-med offerings, basically, what their courses were like. You can kind of look up course reviews sometimes, so I knew the main courses that I would have to take. I ended up getting into the honors college at Ole Miss, which is why I chose that. So if you can get into a certain program within a school that might help you get into medical school later, then that's, going to be your best option. Or scholarships. Any scholarships you get, you can write down on your application. So if you're going to go to a school that will offer you a lot of scholarships, that's great. It's great financially, and it's great as far as applying goes. So definitely look into all the schools and figure out, I went to Ole Miss, and it's not Harvard and it's not Yale, and I still got into a great medical school. So you don't have to go to an undergrad that is like the top, but go somewhere where you want to go, where you see yourself succeeding. But if you're, also really interested in those classes, look at that and take a tour, and you can ask plenty of questions. A lot of times they'll be able to set you up with the pre-med advising committee. I had a great pre-med advisor. So you can ask whenever you're looking at the schools, you can ask if that's something they have, like a pre-med committee. Because I was kind of surprised to know that pre-med itself was not a major at the school I was offered. They just offer kind of like pre-med tracks, or they tell you the classes you need, and you sign up for those. So really just asking a lot of questions about what's important to you to choose the right undergrad. And then there'll be a whole new batch of sets of steps you need to take to get into medical school. But the first thing would be just getting yourself into the right university that you're comfortable at and that you see yourself succeeding at, so that you can do well and then move on to medical school, but one step at a time.
I think that's really great feedback to share, is that you don't necessarily have to go to a school that's not defined as pre-med. I think what we like to talk about a lot is there's different paths for everybody. Somebody may go to everybody takes a different path, whether that is starting out in one career and ending up in another, or knowing you've wanted to be a doctor since you were 3, but it's really, everybody has their own way to get there, and how you get there is fine. It's just that find what you're passionate for, and that's how you're going to get and enjoy work, and enjoy not just work, but enjoy life too, because you don't want to go to work every day and be like, why am I here? When you don't, if you feel that passion and you feel that doesn't feel like a job, right?
Yeah.
How about you, Teri? If I was 15, 16, high school kid, what are my next steps that you would say that would be a good way to take?
Yeah, definitely. I would say, make school somewhat of a priority. Put some effort into it, because it really does pay off in the end. If not, I feel like it kind of takes a little longer to get where you want to be if you're not taking things serious when you have that opportunity. Certainly we have our parents and we have people that we know, if they know something about it. If not, I would definitely reach out to the guidance counselors and, let them know what you want, and figure that track out, because there is a way for everybody. And it's okay to start out at your community college. It's perfectly fine. I eventually did get my BSN, and I did that online. So there's just different ways of doing everything.
It sounds like the consistent conversation we have is ask questions, do your research, and put the work into it to really find out what you want to do. And when you do know that, put the work into developing yourself in that career. Jordan, do we have any questions? I don't see anything in the chat. Do you have any questions you would like to add?
I see that we have some students here. I don't know if you guys want to get off mute and ask anything at this time. I just have to say real quick, I thank you guys so much for the line of work that you're in and pursuing, because you guys have to give up a lot in the medical field. You're missing holidays of family, working long hours, having to be on call. I think that's a lot of stuff that people take for granted. And at the end of the day, though, what you do is so rewarding, I'm sure. So hopefully it makes it all worth it.
I'd choose it again. But it is hard right now. I'm not going to lie. It's tough.
Yeah,
we're all in it together.
Yeah, I'm sure COVID has really it's been a rough year, and our students have been, some of them been remote most of the year too. So hopefully we can get stuff back to in person next year and get them back out to job shadows and site visits and get to really see the work and really get involved in it.
Yeah.
I'll put it out there. If there's anything else you'd like to add, Teri, we can go with you. If there's anything else you want to add, if we didn't talk about something, go ahead and go take it away.
I just encourage everyone, if you really want something, you have to work hard for it, and you can get there. You'll get there eventually.
Awesome. Addie?
Yeah, if it's something you really want, same as Teri said, you will be able to get there, and there's plenty of people out there who are willing to help. So I don't know how you can get my email out to them, but I know that it's kind of overwhelming to look that far in the future. But if any of you guys have any questions at all, please feel free to reach out, because like I said, I didn't have no one in my family just knew exactly what to do for me to get there. It took a lot of question asking and reaching out. So I'd be willing to help with anything I can.
Thank you. I think that's awesome. And I will be sure to share your email with our coaches in all 5 of our schools, and they can reach out directly if they have any students that have any questions or that really want to. A lot of what we do is, getting guest speakers, and that would be something you could go into and speak to a class about your path, how you got there, because as we say, everybody gets to their point different. And it's all about, getting to where you find a success in life and a success in a career. So thank you for all that you do. Please stay safe out there. And thank you for being here today. I really, really appreciate it. And if I have any student questions that come through, I'll be sure to reach out to you guys directly.
Thank you.
Thank you so much. Good luck. Bye-bye.
Bye-bye.